Hello, I'm Heather Knox, Chief Executive here in NHS Lanarkshire. I'm going to talk with you today about three things. First of all, I'm going to talk about the numbers of COVID patients we have across our hospitals here in Lanarkshire. Secondly, I'm going to say a bit about vaccination. And thirdly, I'm going to say a bit about testing and what we need to do around that. So first of all, just to talk about the numbers, we're still in the third wave here in NHS Lanarkshire of COVID, and we have 177 patients who've tested positive with COVID across our three acute sites today. That has been trending down, so that's a good thing, but we still have significant numbers also within ICU, which is putting pressure on the system. I think we have about 15 people across the three sites with COVID across our ICUs. The good news is that the number of outbreaks in care homes has now gone down into single digits, so that is a great step forward, and it's giving us some early evidence that the vaccination is actually working, so that's good news for all of us. And I know many of the staff will have elderly relatives in care homes, so that'll be particularly important for you, and also with the opening up of visiting, I think that's going to be great news for a lot of people as well. If we go next to vaccinations, we passed a bit of a landmark this week. We've done 120,000 vaccinations across NHS Lanarkshire now, and we need to vaccinate about 500,000 population. So we're well on our way, and that programme is not without its challenges, but it's going well. The key constraint at this time is actually vaccine supply rather than anything else, and that's a good place to be in. The third area I wanted to talk about was testing. We're about to embark on community testing in two areas within Lanarkshire, so you will see the units popping up in Airdrie and also in Lark Hall. And those two areas were chosen because there's higher rates of incidence of COVID in those areas, and also there's less testing happening in those areas. So this is to promote testing, and one of the things you can do for me with your families and friends is just to stress the importance of testing, and likewise for yourselves. Please don't come to work if you've got symptoms. I know you know that, but just remember, I know we're going through the vaccination programme. I know you think that if you've been vaccinated, you can't catch COVID potentially, but you absolutely can. So please don't come to work if you've got symptoms, and encourage your families and friends to be tested. I think that's probably all I wanted to cover off today. Just to say, I do realise that we're not out of this yet. We've got a lot of work still to do, but I'm really proud of the way all of you have responded to this difficult time. Thank you very much.